Dr. Trehan, thank you very much for taking time out of your busy schedule to talk to us. Well, we are in your flagship hospital in the Delhi NCR region, one of the largest private hospitals in the country, 1,400 beds. Tell us a little more about this facility.
So if you go in the background of why we created this such a large platform, was the whole idea that what was missing in India was institutions like Mayo Clinic, Cleveland Clinic, where they have a large platform, where all the super specialists function on the same platform together as a team, rather than individuals. So that's the structure of this place. So if you needed to accommodate this kind of services with the technology, with the safety of the patients, with the ease of doctors taking care of patients, ease of nurses. So if you look at the layout, it's always kept in mind that patient is the principal recipient of the services. The doctors and the nurses and the paramedical are the second most important people who can function. And the third, of course, the families. That we have made these facilities so that the families can also feel a part of the hospital treatment and stuff like that. So there, if you see, we have made lounges for patients who are in ICU. Their families can stay over here. They don't have to go lie in the lobby or anything like that. There are like full facilities for them. So that was the reason why it is it's 2.4 million square feet. And we have now like 30 super specialties working on the same platform, led by the institution heads who are actually benchmarked around the world. So it creates that kind of confidence in people, and also the outcomes. That because all the people are working together on the patients like it's everybody's patient, then these heads together can create magic. So I'll tell you, supposing somebody has heart problem, can also have GI problem, bleeding GI, they have diabetes, they may have neurological problems from before. So if you have specialists of that variety working together as a team, then your outcome will be better than you would if you were working individually. Now that is the principle on which this was based. And I mean, like if you want to say, the proof is that today we can tackle over here situations where many people around the world would say these people are inoperable, or they need nothing more treatment. So we actually have the confidence, and we have proven it even in our records, that there is so much benefit of creating this kind of platform, that the outcomes in the most critical of patients is very favorable.
So that brings me to actually medical tourism, medical value tourism, because somebody did point out that, when you go to Medanta, their flagship hospital in Delhi, you'll actually feel like you've entered a hotel. And that's how fancy it is. But does it also, the fact that you focus that much on super specialities, the amount of focus in terms of the softer aspects of the hospital as well, what is that doing when it comes to medical tourism? Well, or medical value travel?
Yeah, so we have, before COVID, up to about 12% of our patients were international. Then COVID, of course, with the restriction of travel and COVID itself, lockdowns and all that, that went down to about 3-4%. Now it's on its way back up. So we are one of the favored destinations because of the fact that we are a seamless institution. From the moment they connect with us, we receive them at the airport, we bring them here, we treat them, we will then see them off at the airport. So we are from that point of view, patients also find it very secure. See, one of the things, if you're coming to another country in an unknown city where, there are so many vagaries at play, that it gives them huge comfort that you can give them this kind of service.
So it had fallen to around 4% of sales during COVID, and medical value tourism has probably risen to around 6%, 6 to 7% now.
Right. No, maybe it's a little more even now from the time as we are talking, because the recovery is much faster. And the biggest bottleneck has been the visas. So the embassies are really now geared up because it was all disrupted. So now the pending visas are being issued. We have, as we speak today, over 140 visas waiting in Iraq to come. Okay. So, and the other thing is that the Prime Minister has announced these two schemes, no, Heal in India, Heal from by India. And that also has triggered that all the services that participate, and you start from patients, recognizing or talking to the doctor, or recognizing which institution to go to. From that point to send them letters for the visa letters, from the visa to the airport, all those things are now being stitched together. So I think that India has a huge future for actually serving our countries, immediate countries and extended countries.
But what is the USP that India has vis-a-vis the other countries that are equally focused on medical value tourism?
So there are three major things you can speak of. One is that we have the highest level of care available here across all specialties. So that you cannot, if you close your eyes, and I took you to Cleveland Clinic today, and you opened your eyes there, you would not know the difference where you are. So that is one part of it. Second is the fact that the cost is much less. So they're not paying for cheap services at cheap price. They are paying for a lesser price for very high-end services, which are comparable. And the third important thing is that language is another situation, that we are more universal in English than other countries because they have that impediment. So I think that they feel very comfortable. India has a good image, improving, I would say. And things like what is happening in Delhi with the pollution and all that doesn't help. So as we move forward and try to solve these problems, I think undoubtedly India will be the premier destination of all other competing nations.
When do you expect it to probably rise back to its peak of 12%, maybe surpass it as well?
I think that past Christmas, you will see the whole surge.
Okay, so you'll probably see it back to 12%.
We are already 7-8% already. So you're seeing it as we speak every week, it will go up a percent.
And sustain at probably 15% or higher?
Could be higher even. That's what we are aiming for. And why not? Because it is, you see, that also demonstrates the soft power of India. That, as you know, I was in the US for 20 years. So 17% of all super specialists were Indians in America, right? Out of 350 million people. Today it must be much more. If you look at NHS, 30% of the doctors who do the service are Indians. If you look at the nurses, they're all over the place. So the branding of India as a superior human capital is already established, right? Now the question is, how do we actually capitalize on that by improving our services and our environment?
We do have a deficit when it comes to the doctor-patient ratio in India, the nurse-patient ratio in India. How do you think that we could probably bridge that gap? Because you are talking about how, and we've seen it ourselves, the US and probably the UK have some of the best doctors who are of Indian origin.
True.
How do we get that brain drain back into India?
So, I am a believer that brain drain is just an investment overseas. And as facilities like this get established more and more, they find it very convenient. Now, we have made a hospital in Lucknow, we have made it in Patna. So when we started here, people came from overseas. Doctors who were serving there at the highest level, they came back because they were always looking for a place to function with this kind of facilities and this kind of ethos. So I think that as we move forward, more and more people will be attracted back, but that's not what we have to depend on. I mean, if you do look at it, 3,000 doctors go overseas every year out of the 80,000 that we actually graduate. What we need to do is to, from day one to starting the medical colleges, to controlling the quality of the medical colleges, postgraduate training, increasing the number of seats available to these graduates to be able to become specialists, then super specialists. So we need to build that whole thing, which is happening as we speak, but it's a long process. It takes 5 years to get out of medical college, then another 5 years to become a specialist. So we are talking about the seeds have been sown, but the reaping will be another few years from now. It's not available immediately.
You mentioned Cleveland Clinic a couple of times. Is that your inspiration?
Yeah, yes, absolutely, absolutely.
Is that what you're planning to probably expand? Currently you're just focused a lot on North. You have a hospital which is coming up in Noida as well.
Right.
What about the rest of India?
Well, we are agnostic, you can say, to any location. The principles that we go on are one, that we, as a DNA of ours, that we want to provide the highest end of care in areas which are suffering. So you take the choice of
But we're suffering across the board.
200 million people in UP who did not have this kind of facility. So we created there. Bihar is the other one, where 120 million people and no really facility to speak of. So we established there. Noida is a sea. If you go to Noida, the population doesn't end, right? It just goes on and on and on. It's almost reaching Meerut. But there are no facilities of this variety. So that's why we were building there. Now, if you look at it, the chain from Patna, which is basically in the east, then UP, then Gurugram, Noida coming up. There will be some other which are in plans, which we will let everybody know in the near future. And then this story will go on. So we cut across through the heartland of India. We are serving over 400 million people. So this footprint is very, because we are also, so if you look at it, I said people who need it, the standard should not be diluted.